The problem is with the Bankart repairs, and you saw great examples of that, is they fail. That's the problem. You're adding remplissage. You've got to add something else. There's just a very small, narrow sliver of patients where you can do that procedure. Let's talk about the real procedure, which would be coracoid augmentation or the latter J. These are my disclosures. So a coracoid transfer in the latter J is not just moving the bone. In a distal tibia, you're just moving the bone. So you can eliminate bone loss, but with the latter J, we get the sling effect, we get inferiorization of the subscapularis, and you have the conjoined tendon effect that all can better improve our stability, especially in our contact athletes and the ones that really need to be stable. So when you compare mechanically latter J versus bone blocks, they're all stable, but you get extra effects with the latter J. It outperforms the bone graft in reducing anterior translation at 60 degrees of abduction. The authors recommend latter J to restore stability with glenoid bone loss. In Dr. Athwal's paper, which was referenced earlier today, when you compare the loaded versus the intact latter J, they stabilize 100% of the specimens with significantly less humeral head translation. And the last time I looked, this is the goal of the surgery. This is why we're doing this whole surgery to begin with. This is the reason why you're there. When you look at outcomes of latter J versus distal tibial allograft for anterior shoulder instability repair, what we're looking at, what everyone argues about, are the complications associated with latter J. And there's no question there's complications. That's a much larger procedure. It's a more dangerous procedure, but no difference in complications in this matched cohort analysis. And again, no differences in complications. So does not mean more recurrent instability, but you get extra with the latter J and the coracoid. So let's go through an arthroscopic latter J. So we're looking from anterior superior